Welcome back, my people. We are still talking all on our topic about rotavirus, and in this video we will be looking at the vaccines available as one of the treatments which can be applied to eradicate rotavirus. Before I start, let me appreciate you people for the support you are giving me, the subscriptions, the topics you are giving out to discuss, the comments and everything. So, let's continue keeping the spirit and keeping the support on. And I'm sure, as I've always said, we will all benefit from this. So lovers and haters, let's continue sharing, subscribing with our brothers and sisters, so that our videos may reach as many people as possible. So, rotavirus vaccine was first introduced in the year 2006, and since its introduction, hospitalization or admissions and deaths from rotavirus have dropped significantly. So after the introduction of this vaccine, hospitalizations and deaths due to rotavirus has dropped significantly. So, prevent your child's rotavirus complications by making sure he or she gets the vaccine or becomes vaccinated in the right time, because the vaccine comes in two forms. We have two kinds of rotavirus vaccines. Number one, we have what we call Rotavirus, and should be given to your child at 2 months, 2 doses, 2 months and 4 months. You give the first dose as 2 months, the second dose at 4 months. The next, or number two, is what we call Rotatec. Rotatec comes in 3 doses. You give at 2 months, you give at 4 months, you give at 6 months. 3 doses. A point to note: both the vaccines are oral. That means the route of administration is through the mouth. Both vaccines are oral. That is, they are given through them and or administered by mouth, not an injection. A point to note: no vaccine is available for older children and adults. That means if you pass the age of 6 months, you can't get a rotavirus vaccine, because it's not available for older children and adults. And it's the reason why healthcare professionals recommend getting rotavirus vaccine at a young age. Why? Because it's not available for older children and adults. So a child should make sure, the parent should make sure the child gets it at a younger age. Rotavirus vaccines prevents nearly all severe cases of infection. No vaccine is 100% effective. It doesn't mean if your child is given rotavirus vaccine, he or she will never get diarrhea of this kind. It just reduces the symptoms or makes it less severe. That's why we have said no vaccine is 100% effective. You can always talk to your pediatrician about the risk versus the benefits of this type of vaccine and whether it's the best preventive measure for your child. So before you give the child this injection or before you make this decision, talk to your pediatrician or your healthcare provider about the benefits and disadvantages of giving or not giving this vaccine before you go for it. So you have to know whether it's the best preventive measure for your child. Babies, this is very important. Babies with the severe combined immunodeficiency or intussusception, or who are already severely ill, should not get the vaccine. So if your child is severely ill and the child is weak, this kind of a child should not get this vaccine to avoid its complications. Rare side effects of rotavirus vaccines include the following. That means it has some side effects, but they are rare. Number one, it might bring about diarrhea. Number two, fever. Fastness. Fastness means that the baby is crying a lot and difficult to calm down. We have number four, irritability. And we have what we call intussusception, which means bowel blockage that causes severe abdominal pains, vomiting, and bleeding stools, though it's rare. It can bring abdominal pains, vomiting, and bloody stools, though it's rare. When, this is a question I'm posing to you, when should you call your doctor or seek medical advice when your child is having rotavirus? Number one, when there is constant vomiting or the child is vomiting repeatedly. Number two, when the child has frequent diarrhea for 24 hours or longer, because this will cause severe dehydration. Number three, when the child is irritable to keep, or the child is unable, when the child is unable to keep fluids down due to diarrhea and vomiting. Another point, when the child has high-grade fever. Another point, when there is a decrease in urination or fewer wet diapers. When you see those signs in your child who is having rotavirus, make sure you contact your healthcare provider or take your child to a healthcare provider. This marks the end of our video, and in our next video we will be talking about transmission of rotavirus or how it can spread in depth. Let's keep the support on. Let's continue subscribing, sharing, and commenting on our videos so that they may reach as many people as possible. Keep the support on, and let's stay tuned for more educational bangers. Have a good evening.